We've all been told how important it is to get the flu shot this year. Even with supply challenges at many pharmacies, there is some positive news. Influenza cases have dropped significantly so far this year, and there could be multiple reasons why.
Just gonna be a quick pinch. 1, 2, 3.
This year has the potential to become what doctors are calling a twin-demic. A rise of COVID-19 cases, along with a steady stream of influenza patients, would cripple our healthcare system. Though there's reason for optimism. Early data released by Health Canada's Flu Watch is reporting just 5 influenza cases so far, compared to the more than 430 cases we usually average by this point of the season. All the COVID protocols we're following could be helping.
The fact that people wash hands, put a mask on, stay at a distance, and reduce their social interactions definitely reduces the rate of influenza.
Another hopeful Health Canada indicator is that in the second last week of October, the percentage of positive influenza tests reached just 0.2%, compared to the average of 2.8% we normally see by this time of the year. One infectious disease specialist believes the lack of international travel could also be a key factor.
We don't see influenza, that just naturally triggers in Canada. We see influenza coming into Canada during the winter season and then propagating due to people coming over the border with influenza. Because travel is so frowned upon these days and people are quarantining after travel, we may not have much seeding of the community with influenza as well.
Families are also taking the flu much more seriously in 2020. A recent international study led by UBC's Dr. Rand Goldman surveyed 3,000 parents from 6 countries, including Canada and the U.S. They found that more than 30% of parents whose children didn't take the flu shot last year are making sure their kids get one this year.
Their level of concern of COVID-19 made many more parents suggest that they will give the vaccine to their child.
If someone's watching this and they say, oh, well, cases are going to be way down this year, forget it, I don't need the flu shot, what would you say to them?
Healthcare institutions are stretched to the brink already, and so dealing with influenza on top is going to break healthcare systems. And number 2 is, listen, even if you don't get sick, if you even get runny nose, sore throat and with influenza, do you really want to be standing in the assessment center lines waiting for a test? Do you want your kids to get pulled out of school because they are symptomatic?
Health officials here in Canada often look to Australia as they try and predict how hard we'll get hit by the flu here at home. Now, down under, the Aussies saw a big drop in influenza cases, though we are being warned to remain vigilant. I'm Adrian Ghobrial for City News.